Listen, in early 2026, you probably saw those sensational headlines popping up everywhere. A deadly viral outbreak on an isolated cruise ship, the MV Hondius. Panic sets in fast these days, right? And it is so easy to let those headlines just trigger our absolute worst fears. But today, we're cutting right through the noise and the clickbait in this explainer. We're going to look strictly at the cold, hard facts of this outbreak to understand exactly what happened down in the South Atlantic. Because as we'll see, context is absolutely everything when evaluating global health news.
So, that brings us to the elephant in the room, the question that was literally on everyone's mind. Is this cruise ship hantavirus the next COVID? Honestly, it's a completely natural, almost reflexive anxiety to have whenever we hear about mysterious outbreaks on ships. We've all been there. But to demystify this crisis, we really need to separate the trauma of the past from the science of the present. Let's dive into the virus itself, the global response, and why health experts were actually urging calm. Okay, so here's how it all went down. The outbreak unfolded really rapidly and across a highly remote route. On April 1st, 2026, the MV Hondius departed Ushuaia, Argentina, heading deep into the South Atlantic. Just 10 days later, tragedy struck, when the first death occurred on board. The suspected index case was actually a man who likely contracted the virus while birdwatching at an Argentine landfill right before boarding. And because the ship was so incredibly isolated out there in the ocean, it wasn't until April 24th, when they reached the remote island of St. Helena, that complex medical evacuations could even start. Finally, by May 3rd, the whole ship was securely docked in Praia, Cape Verde.
Now, before we look at the broader spread, we definitely need to take a moment to soberly acknowledge a really tragic number, and that number is 3. 3 passengers lost their lives during this voyage. It's a very serious, deeply tragic, localized event, and our thoughts are absolutely with those families. But looking at it strictly from an epidemiological standpoint, a cruise ship is essentially a closed ecosystem. It's like a floating bubble. So to properly understand the actual global risk, we have to look at the broader context of that isolated, highly controlled environment. When we break down the data from the ship, the true scale of the outbreak comes into sharp focus. There were 147 passengers and crew isolated on that ship. Out of that total, there were 6 confirmed cases and 9 suspected cases. Now, while every single one of those cases requires intense, round-the-clock medical care, this ratio is incredibly revealing. Think about it. Despite the super close quarters of a cruise ship over a month-long voyage, only a very small, highly concentrated cluster of people actually contracted the virus.
So to understand why that cluster remains so remarkably small, we really have to look at the mechanics of the virus itself. The culprit here is the Andes virus. It's a specific strain of hantavirus that's endemic to South America. Normally, humans get a hantavirus by accidentally breathing in aerosolized particles from infected rodent droppings. Yeah, not pleasant. But the Andes strain is unique because it actually holds the rare ability to spread human to human. But wait, here is the absolute critical distinction. This isn't passed by casually walking past someone in a hallway. Not at all. The spread requires intensely close, prolonged contact. We're talking about sharing a tiny cabin or providing intimate medical care to a highly symptomatic patient.
Even so, because of that human-to-human transmission risk, global health authorities weren't about to leave anything to chance. An aggressive multinational logistical operation was spun up almost immediately. Critically ill patients underwent these highly complex medical evacuations from the middle of the remote Atlantic all the way to specialized hospitals in Europe and South Africa. And it didn't stop there. The 30 passengers who disembarked early in St. Helena, they were meticulously contact traced. With the UK, the Netherlands, Spain, South Africa, and the World Health Organization all operating in lockstep, this whole operation was basically a textbook example of a highly managed, localized containment strategy.
To combat all that media frenzy we talked about earlier, health officials had to be incredibly direct. Just listen to this statement from Maria van Kerkhove, the Director of Epidemic and Pandemic Management at the WHO. She said, "I want to be unequivocal here. This is not the start of a COVID pandemic. This is not COVID. This is not influenza. It spreads very, very differently." I mean, wow, that is a powerful, definitive statement specifically designed by the experts to explicitly diffuse that pandemic panic. To understand exactly why the WHO was so confident, we just need to compare the biology. It's basically apples and oranges. The Andes hantavirus is not some new, unpredictable mystery. Scientists have actually studied hantaviruses for decades. Plus, it has a very slow mutation rate, meaning it isn't just constantly evolving new ways to sneak past our immune systems. COVID-19, on the other hand, was a completely novel virus, highly contagious through everyday airborne respiratory droplets, and it mutated incredibly fast. Because this hantavirus requires such heavy, prolonged exposure to transmit, they just belong to completely different threat categories.
And that brings us right to the bottom line. The US CDC issued a Level 3 monitoring response for this. Now, I know what you're thinking. Level 3 sounds pretty alarming, right? But Level 3 is actually the lowest classification on their emergency scale. It literally just means monitor the situation. At the same time, the WHO officially assessed the risk to the global population as low. So yes, the localized medical response was intense, and rightfully so, to protect the folks directly involved. But the worldwide threat level remained incredibly minimal.
Which leaves us with a really critical reflection for this post-pandemic era we're living in. When an isolated tragedy strikes, how quickly do media headlines weaponize our past trauma just to drive up anxiety and, let's be honest, clicks? It is so easy to let sensational reporting dictate our fears. But as the 2026 MV Hondius outbreak shows us, taking a step back and looking closely at the structured data and the biology almost always tells a much calmer, much more manageable story. Thanks for joining me to explore the facts in this explainer. The next time a scary headline pops up, just ask yourself, are they reporting the science or are they just selling the panic?